Michelle has been a patient of ours for a few years right now, and she usually comes in because she was doing something silly, blowing up all of our balloons for her job, because she owns a balloon business. And recently, she's had some right-sided mid-back pain, rib pain, medial to the scapula, inside the scapula. And it would be irritated when she rotates her upper body to the left or the right, and also when she takes a deep breath, which indicates one of the muscles that's responsible for breathing, likely the joint or the levator costarum muscle or intercostals, are irritated, provoked. So what's cool about this treatment is I think I did 5 different tissues, and she started at 8 out of 10 pain, and each tissue I did stair-stepped it down to 7 out of 10, 5 out of 10, 4 out of 10 to 3 out of 10. So it was more than 50% better at the time we were done. And I was treating the ribs and the long thoracic nerve that goes by the armpit, and the spinal accessory nerve that goes down the mid-back, down the rhomboids, and a bunch of stuff that will be involved overloading the breathing muscles of the mid-back. Enjoy this video with Michelle.
To the right a little bit. Pulls, so kind of like pulls.
In the spot?
Yeah.
How intense is that pull? 0 to 10?
8.
Just twisting it all? Provoking pain?
A little bit, yeah.
Yeah.
Mm-hmm.
Which
More
side?
to the right. I feel it like my upper ribs, maybe. I don't know. It's hard to
Okay.
tell where it's like.
That's 10.
Not so much to my left, more to the
To the
right.
right?
Yeah.
Okay. Alright, rotate to the right for me, please. What do you feel here?
It's a pull.
Pull?
Yeah.
How intense?
An 8.
So she says that she felt the pain more close to her spine and her back. She said she felt it when she rotated her head, so I wanted to see if she also felt it rotating her body. So we tested thoracic rotation. The range was not the best, it was about 22 degrees, and she felt a pull. That was intense, 8 out of 10.
If you rotate arms across your chest,
Mm-hmm.
keep your head on your spine. Yes, exactly. Is it
Yeah,
still
I
8
feel
out
it.
of 10?
Yeah, it's actually probably 9.
Okay, and then, is that 8 out of 10?
No, actually I don't feel that at all.
Do you have a hair tie?
No, I'm just feeling hair
the last
ties from
one.
you.
Go.
They're all in the
20
car.
hair ties. 20 barefoot hair ties in the car. In this area?
Down a little bit. Kind of starts there. It's definitely starts there. I would say more to the right and down like a hair. It's like in there somewhere.
Okay. What about to the left? Does that bother it?
No. Maybe a little pull, but not as intense.
Cross your arms across your chest. Rotatories. And it needs to lengthen when she turns to the right, so the fact that when I rotate her to the left, I mean that pulls super tight though. She's just not having pain with it, so how relevant is this? I don't know. But yeah, I want to treat this. We'll see what happens. So we're gonna go down to the left here, so if you can push in, yes. So I'm letting my palpation trump her prerogative test just because that felt super tight. Against here.
I still feel a pull.
0 to
'Cause it
10.
feels like a 7.
Here,
Uh-huh.
rotate. Did that change it?
It pulls.
When her arms are crossed, it's pulling the rhomboids tighter. It's easier when her arm is down. So that means that it must be something that attaches the scapula. So instead of checking those rotatories and joint capsules that we just did, I'm checking her spinal accessory nerve, which is between her rhomboids and upper traps. and she's really sore right here and it feels stuck. So we're gonna do spinal accessory nerves here.
Okay.
So that nerve comes out up here and there are a bunch of different spots and then goes down over the levator and then goes straight down the middle of her back. It comes out of her skull too. It's cranial nerve 11, I believe.
There was the pop.
Yeah?
Did you feel it?
I didn't,
Okay.
but I believe you. So it's just like this, so I'm pushing it. I'm trying to see where it's the most stuck. She's got some nasty stuff right here. So her long thoracic nerve comes out of C5. Comes this way and then goes under and goes down between her serratus and her subscap, and I felt it pretty tight right there. That's better. 0 to 10.
5? No, it feels lower, somewhere lower now. Like the pull is lower.
Rotate towards me. That's not good right there. Okay. Her intercostal muscles, so her intercostals are her ribs. They wrap around the cylinder of her rib cage. And she said that some of her symptoms are provoked by deep breathing. So if she has adhesion here, she can't rotate to the right, and it also will prevent her. She'll have symptoms when she takes a deep breath. So we're gonna see if it changes at all. That's better. 0 to 10.
3, 4?
A little better.
Yeah. Not 100%. I still feel it pull.
Here.
No, lower again. Like it keeps going like lower, 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 like every single time.
You said 4 before? 0 to 10.
I'll give you a 3.
3.
If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.